How do stroke types differ? Understanding each one. Imagine your brain as a busy city powered by a complex network of roads carrying vital supplies. When these roads are blocked or burst, the city faces chaos, which is what happens during a stroke. Strokes happen when blood flow to parts of the brain is interrupted, causing brain cells to die from lack of oxygen. There are two main types of strokes based on what causes this interruption: ischemic strokes and hemorrhagic strokes. An ischemic stroke is like a traffic jam on one of those busy roads. It happens when a blood clot blocks a blood vessel that supplies blood to the brain. Most strokes are ischemic, making up about 85% of all cases. These clots can form directly in the brain arteries, which is called a thrombotic stroke, often due to buildup of fatty deposits called plaques. Or, the clot can form elsewhere in the body, like the heart, and travel to the brain, which is called an embolic stroke. This travel of a clot from one part of the body to the brain is similar to a car accident caused by a vehicle that suddenly appears out of nowhere. Because blood flow is blocked, the affected brain area can't get the oxygen and nutrients it needs, leading to symptoms like weakness, speech problems, or vision changes. Quick treatment to dissolve or remove the clot is crucial to limit brain damage. On the other hand, a hemorrhagic stroke is like a burst pipe flooding a section of the city. It occurs when a weakened blood vessel in the brain suddenly ruptures, causing bleeding inside or around the brain tissue. This bleeding damages brain cells and increases pressure inside the skull. Hemorrhagic strokes are less common but tend to be more severe. They are divided into two main types: intracerebral hemorrhage, where bleeding occurs directly into the brain tissue, often due to high blood pressure weakening the vessel walls, and subarachnoid hemorrhage, where bleeding happens in the space between the brain and the thin tissues covering it, often caused by a ruptured aneurysm or a weak spot in a blood vessel. Symptoms can include sudden severe headache, nausea, and loss of consciousness. There's also a condition called a transient ischemic attack, or TIA, often called a mini-stroke. It happens when blood flow is temporarily blocked, causing stroke-like symptoms that last less than 24 hours. Unlike full strokes, TIAs don't cause permanent damage but are warning signs that a more serious stroke could happen soon. Recognizing a TIA and seeking immediate medical care can save lives. Sometimes, strokes are classified based on their cause when no clear reason is found after thorough testing. These are called cryptogenic strokes. Other times, strokes are categorized by the part of the brain affected. For example, a stroke in the brainstem can impact vital functions like breathing and heartbeat, leading to severe disability. A stroke in the cerebellum can cause problems with balance and coordination. The side of the brain affected also matters. Strokes on the right side can cause weakness or paralysis on the left side of the body, and vice versa, along with specific issues like speech difficulties if the language centers are involved. Understanding these differences is key because each type of stroke needs different treatment strategies. Ischemic strokes often requiring clot-busting medications or procedures to remove the clot, while hemorrhagic strokes may need surgery to stop the bleeding and relieving pressure. Fast diagnosis and treatment are essential to reduce brain damage and improve recovery chances. In summary, strokes differ mainly by whether they are caused by a blockage or bleeding in the brain. Recognizing these differences helps doctors choose the right treatment and can make a big difference in outcomes. If you or someone you know shows signs of a stroke, such as sudden weakness, speech difficulty, or severe headache, seeking emergency medical care immediately is the best step. Always remember to consult healthcare professionals for personalized advice and treatment options.